Okey, bab 10, chapter 10 of form 4, kimia dalam perubatan dan kesihatan, which is one of the very important chapter that you guys will need to cover. Let's discuss all these questions from objective structure to essay. Okay, now let's look at the first question. Which of the following is the function of psychotherapeutic drug? Now, antara berikut yang manakah fungsi ubat psychotherapeutic? Now, this particular medicine is to treat psychotic condition, something to do with our mental health. Okay, psychotherapeutic. Okay, psychotherapeutic drugs are something to do with our mental health. To relieve pain, no. Pain is analgesic. Remember all these. Take note on that. Analgesic. Analgesics are something related to pain, something related to your joint pain, something related to your inflammation. That is something related to analgesic medicine. Psychotherapeutic is mental health. So, for example, depression. Okay, to depression, menghilangkan rasa resah. That is something to do with your psychotherapeutic drug. Relief pain, no. Disease caused by bacteria, it is usually antibiotics. Antibiotics, take note on all this. Antibiotics. Now, we are talking about modern medicine now. In this chapter, you will be learning about the traditional medicine and you will be learning about the modern medicine. Now, we are talking about the modern medicine here. Okay? Antibiotics is something to treat bacterial infection. Now, virus infection different. Virus infection you treat with vaccines, not antibiotics. So anything to do with virus, you will need to treat yourself with vaccines. Antibiotics, yes, that is caused by bacteria. You treat that with antibiotics. Now here, psychotherapeutic drug, it is to alleviate depression. Number one is boy. Got it, huh? Okay, let's look at number two. Which of the following is not an example of free radicals? Now, what are free radicals? Okay, now, out of all the chemicals that we have, we got something called the free radicals that will alter our molecules that we have, which it will may cause oxidation, or it may cause some changes in our chemical structure. Ascorbic acid is known as antioxidant. Remember that, okay? We got the opposite of free radical, we got antioxidants. Okay, antioxidants. Okay, opposite of free radicals is antioxidant. So they already in the question, they said bukan merupakan contoh radical bebas. Pesticide is a free radical. Cigarette smoke is a free radical. Electromagnetic radiation is a free radical. All these are free radical except for ascorbic acid, which is the opposite of free radical. We call that as antioxidant, that prevents the free radicals to oxidize the chemicals that we have. So number two, your answer is definitely A. Ascorbic acid, and another term, we call that as vitamin C. Ascorbic acid is the vitamin C. Okay? Free radical can cause harms. Free radical can cause cancer. Okay, it can cause cancer. So free radicals are the one that is quite dangerous. Okay, for example, when you cooking food, for example, satay get charred. Charred means it will become black. Now that is basically, it produces free radicals there. You understand what I'm saying? So to reduce the free radicals, what we do, we will eat something that is that has a lot of antioxidant. For example, if you look at onions, okay, you look at satay, they always serve you with timon and onion, fresh timon and fresh onion, because it contains antioxidant that will counter the free radicals. Number 2A is your answer. Let's look at number 3. Which of the following is not the function of antioxidant? They ask not the function of antioxidants. Neutralizes free radical. That is the function of antioxidant. Yes, number 1A, I can take that. Okay, I can take that. But they're asking not the function of antioxidant. Neutralizes free radicals is the function of antioxidant. Prevents the damages of normal cells, protein and fat. Yes, it prevents the damages of the normal cells, even protein and fat. It prevents the damages. That is the function of antioxidant. So B is the function. It completes the shortage of electrons in free radicals. Yes, free radicals are basically components that has shortage of electrons. That is why it becomes radical. And so it completes the shortage of electrons in free radical, melengkapkan kekurangan elektron yang dimiliki oleh radikal bebas. Itu adalah fungsi antioksidan. Accelerates the formation of chain reaction of free radicals. That is not the function of antioxidant. It actually reduces and stops the formation of chain reaction of free radicals. Now, that is how we have to think about antioxidants. Now, that donkey is not the function, so I picked donkey. Now, read the question carefully and answer accordingly. Number 3, donkey is your answer. Number 4, let's look at number 4. Number 4, okay, which of the following is not an antioxidant? Okay, antara berikut yang manakah merupakan bukan bahan antioksida yang digunakan sebagai barisan pertahanan terhadap risiko mendapat serangan penyakit. So, bukan merupakan bahan antioksida. Not an antioxidant. Not an antioxidant used as a protective barrier towards the risk of getting certain diseases. Lutein is a antioxidant. Beta-carotene is an antioxidant. Vitamin C is an antioxidant. Cobalt-60, no. Cobalt-60 emits a lot of gamma radiation, and that is a radical, free radical, yeah? So cobalt-60, no. It is opposite of antioxidant. Number 4 is C. Number 4 is C. Okay, number 5. Ujian pengesahan dijalankan secara rutin terhadap kandungan bahan aktif yang bagi sesuatu produk kesihatan untuk menguji kesan sampingan berikut kecuali verification test is performed by routine on the active ingredients of health products to test the following side effects and accept. Okay, verification test is performed by routine on active ingredients of health products. Okay, verification test is performed on the active ingredients of health products to test the following side effects except risk of getting a heart attack. Okay, risk of getting heart attack, reduction of kidney function, everything that is going to cause you harm. Let's look at it. Okay, muscle pain. Okay, reduction of kidney function, risk of getting heart attack. All that are side effects. All that are side effects. Normal blood glucose level is something that what we want. Okay, that is not the side effects. So, mengakibatkan paras gula normal is what my answer will go for. Okay, got it? Huh? Not the side. Okay, the verification test performed by routine. Ujian pengesahan dijalankan secara rutin terhadap kandungan bahan aktif bagi sesuatu produk kesihatan untuk menguji kesan sampingan berikut kecuali verification test is performed by routine on active ingredients except what? Except the following are for tests for side effect, except Okay, side effect. Normal blood glucose is not a side effect. It is opposite that. Okay, so number 5, clearly it is boy is your answer. Number 6, let's look at number 6. Number 6, a housewife has a cut on her hand. She feels pain due to inflammation. Pain due to inflammation. What medicine is suitable to be taken by the housewife? Okay, inflammation. If you are talking about inflammation, okay, paracetamol is analgesic. Okay, but if it is talking about inflammation, you go for aspirin. Aspirin reduces inflammation. Okay, aspirin reduces inflammation. Got it? Huh? Okay, number 7. Which of the following is not the characteristics of modern medical treatment? Not the characteristics of modern medical treatment. Modern medical treatment, the treatment is much more effective and faster, yes, but they are asking which is not the characteristic. Which is not the characteristics of modern medical treatment. The treatment is more effective and faster. That is one of the characteristics. Low cost of treatment. No, I don't think so. Modern medicines are low cost of treatment. Clinical evidence of effectiveness. Yes, we have clinical evidence of effectiveness. Treatment using synthetic medicine. Yes, treatment using synthetic medicine. All that are the characteristics of modern medical treatment. But low cost of treatment, no, I don't think so. Low cost of treatment. Okay. Number 8, which of the following statement is true about antibiotics? Okay, which of the following statement is true about antibiotics? Used to treat viral infection? No, I told you earlier, be careful. Antibiotic is to treat what you call this bacterial infection, not viral infection. So I cannot pick A as my answer. Antara pernyataan berikut, manakah benar tentang antibiotik digunakan untuk mengubati penyakit jangkitan virus? Bukan. Antibiotik bukannya untuk mengubati penyakit jangkitan virus. Dia untuk mengubati jangkitan bakteria. So B, a chemical that destroys infectious bacteria. Yes, antibiotic destroys infectious bacteria. Aspirin is one of the example of antibiotic. No, aspirin is an example of analgesic. So it is not antibiotic. Aspirin is not antibiotic. C is rejected. Can control emotion? No, it is not a psychotherapeutic drug. It is an antibiotic. We are talking about destroying infectious bacteria. So I go for boy as my answer. Got it? Huh? Number 9, which of the following is the example of the complementary medical treatment? Okay, which of the following is the example of complementary medical treatment? Now, when you talk about complementary, okay, when you talk about complementary, exercising is complementary. Okay, exercising is complementary, which involves what you call this physiotherapy. Okay, that means you're loosening your muscles, you're relaxing your muscles, you're helping to get your ligaments or tendons better by doing physiotherapy. Is a form of exercising. Radiotherapy is not a complementary treatment. Surgery and chemotherapy, all that is not a complementary medical treatment. Exercising is a complementary medical treatment. A is your answer. Number 10, apakah kesan sampingannya akan berlaku jika pesakit tidak menghabiskan antibiotik yang diberi oleh doktor? Okay, kesan sampingan. What is the side effect of the patient? Okay, what is the side effect of the patient that does not complete the whole course of antibiotic? This is very, very bad. Okay, you should, when they give you antibiotic, try to complete that, try to take it on time as well. Because bacteria are very smart. When they know when they are being attacked by these antibiotics, they will try to create something called they will mutate and they will become much more stronger. They will try to find a way to fight the antibiotics. So you cannot give them time for them to do that. Okay, we shouldn't give them time for the bacteria to develop its resistance towards the antibiotic. Okay, so number 10, the bacteria becomes inactive. No, the bacteria doesn't become inactive. Okay, the bacteria doesn't become inactive. The bacteria becomes hidden in the body. No, they are not hiding. The patient becomes allergic to the antibiotic. No, the remaining bacteria will mutate. There you go. That's the word that I was using. Bacteria yang tertinggal akan mengalami mutasi dan menjadi immune terhadap antibiotik tersebut. So it will develop resistance to the antibiotic. So your answer is donkey. Number 10 is donkey. Okay. Okay, let's look at question number 1 on your structure question. Yeah. This is a very famous question that they will usually ask you about antioxidant and free radicals. If you cut a vegetable, okay, like terong, if you cut, immediately it will try to become black. I mean, will become brown spot or darker spots. Like apple also, it creates brown spots. Now, jadual 1 menunjukkan keadaan potongan pisang yang disimpan di dalam 2 bekas yang berlainan. Okay, potongan pisang, alright. Selepas 2 jam, pemerhatian dibuat terhadap rupa potongan pisang tersebut. Table 1 shows the condition of the sliced banana, which being kept in 2 different containers. After 2 hours, observations are made on appearance of the sliced banana. Initial condition of the sliced banana, they are nice. In container P, they are exposed to air. In container Q, they are soaked in lemon juice. Lemon juice contains antioxidants. So first one, they ask you to state your observation. Okay, they ask you to state your observation of the sliced banana in container Q. Okay, nyatakan pemerhatian Anda terhadap rupa potongan pisang tersebut dalam bekas Q. So they want you to what? State, okay? Observation, write what you see from the potongan dalam bekas Q kan? In container Q, in container Q, state the observation on the sliced banana in the container Q. So you follow what they have inside your table as well. Okay, banana slices soaked in lemon juice in container Q did not change color. Okay, banana slice soaked in lemon juice in container Q did not change color. If let's say they ask me to write down in P, what should I do? Banana slice exposed to air. So you must use the exact components that you have in your table. Okay, exposed to air in container P, change color. Changed color. Okay, in case they want me to write down in answer for container P, but they asked me in container Q, right? Okay. Now, based on your observation in question 1A, state your inference. Okay, state your inference. So my inference is based on my observation. So observation dia nak container Q kan. So inference is where you will give reason. Okay, they will ask you reason. So you say lemon juice contains antioxidants that prevents the oxidation of the banana slices. Okay, lemon juice contains antioxidant that prevents the oxidation of the banana slices. So what happens when they ask you inference for container P pula? So you say, okay, oxygen in the air oxidizes the banana slices, just something like that. Okay, all right, oxygen air in the air oxidizes the banana slices. Okay, all right, C, what is happening in C? Okay, question is, based on this activity, state the operational definition for antioxidant. So antioxidant substance. So first thing that I will do in order for me to write down my operational definition, I will write down what is the component of the antioxidant. Sorry, I will write down the keyword first. Yeah, antioxidants. The keyword they have already given me in the questions. So there you go. Dalam bahasa Melayu, bahan antioxidant. So I write it in English, antioxidant substances. Substance is the, or I can write refers to. Antioxidant substance refers to the component that prevents the color change on the banana slices. So you see what is the responding variable of your experiment, which is something that prevents the color change on the banana slices. So here they have added the lemon juice. Antioxidant substance refers to the component that prevents the color change on the banana slices. So that is what we are looking for your answer for operational definition. Got it up? Okay, next one. Donkey. Give another example of an antioxidant and explain how the antioxidant reacts to the oxidation process. Okay, you can write down vitamin E, okay, lutein, beta-carotene, okay. Okay, let's say I write beta-carotene. Okay, beta-carotene. Lutein, lycopena, lycopene, yeah. Okay, all these are antioxidant. Okay, antioxidants reacts with free radicals. Okay, reacts with free radicals and stops the oxidation process. Okay, let's look at question number 2. Rajat di bawah menunjukkan suatu eksperimen yang dijalankan oleh sekumpulan pelajar untuk mengkaji kesan jenis larutan yang berbeza terhadap pengoksidaan buah apple. The diagram below shows an experiment which carried out by a group of students to study the effect of different types of solution on the oxidation of apples. Okay, apple slices were soaked for 2 minutes. Hirisan apple direndam selama 2 minit. Dan hirisan apple itu direndamkan di dalam satu larutan gula, lime solution, sodium bicarbonate solution, and not soaked in any solution over there. Put on the petri dish and left on the, the apple slices are placed on the petri dish and left on the table for 15 minutes. Dia diletakkan di atas piring petri dan dibiarkan di atas meja selama 15 minit. Okay, the results of the experiments are recorded in the table below. So sugar solution, it turns brown. Lime solution, no changes. Sodium bicarbonate solution, there is no answer over there. Okay, and no solution also, there is no answer over there. Okay, sugar solution is not antioxidant. Sodium bicarbonate solution also, it is not an antioxidant. And no solution, there is no antioxidant as well. So complete the table below. Okay, above, sorry. Complete the table above. So sodium bicarbonate solution turns brown. Menjadi keperangan. Turns brown. Menjadi keberangan. Okay, turns brown. Menjadi keperangan. And for no solution also, menjadi keperangan. This one in our notes, huh? This module is actually in our notes. Come, let me see. Tak ada. Okay, tak. All right. Okay, complete the table above. We have done it. And then based on the table above, why does the apple soaked in lime juice does not undergo a color change? Because lime juice contains what? Antioxidants, yeah? Lime juice contains antioxidants that prevents the oxidation process on the apple slices. Okay, lime juice contains antioxidants that prevents the oxidation process on the apple slices. Let's look at question C. Berdasarkan eksperimen ini, nyatakan fungsi bagi hirisan apple yang tidak direndam dalam mana-mana larutan. Okay, it acts as control. Okay, it acts as control. Okay, based on this experiment, state the function of apple slices that are not soaked in any solution. It acts as a control. It acts as a control. Okay, dia bertindak sebagai kawalan. Bertindak sebagai kawalan. State the hypothesis for this experiment. Okay. Okay. If the apple slices are soaked in the lime juice, the apple slices does not change color. Ramalkan perubahan warna yang berlaku kepada hirisan apel yang direndam dalam jus limau itu jika ia dibiarkan selama semalaman di atas meja ataupun pada suhu bilik. Predict the color changes for the apple slice soaked in the lime juice if it was left overnight on the table at room temperature. So if it is soaked in lime water, it will not change color at all. Okay, so it will not change color. Just like that, your answer is done. It will not change color. Okay. Okay, bahagian B. Let's look at bahagian B. Okay, state one factor that causes the apple to change color. Exposed to the air that contains free radicals. Okay, exposed to the air that contains free radicals. Okay, exposed to the air that contains free radicals is the one that causes the change of color. Based on the diagram above, what is process K? Process K is oxidation process. Pengoksidaan, ya? Oxidation process. Pengoksidaan. Explain with an example how a daily used substances is able to slow down the rate of process state in 1B. How a daily used substance is able to slow down. Explain with an example. So ada dua bahagian soalan, ya. One is explain with an example. how a daily used substance is able to slow down the rate of process state in 1B. So I can go for lime juice. Okay, lime juice, comma, it contains antioxidants. Okay, these will slow down or prevent the oxidation process and prevents the apple slices turning brown. Lime juice, it contains antioxidant. This will slow down or prevent the oxidation process and prevents the apple slices turning brown. Jus limau yang mengandungi antioksidan, ia akan memperlahankan ataupun mengelakkan proses pengoksidaan dan mengelakkan hirisan apple bertukar warna. Got it? The oxidation process takes place in human body. Give an example of the effect of oxidation on the health of the human body. Okay. The oxidation process takes in. Give an example of the effect of oxidation on the health of the human body. Okay, it can cause mutation. It can cause mutation that leads to cancer, increases the chances for cardiovascular diseases, damages liver, lungs, and kidney, increases aging process, increases aging process, all these are examples of the effect. They asked only one. I gave you many in case you will need to for exams. They might be asking you 2 or more, or they might be having 3 of that and they ask you another one of that, another new one. So you should be prepared with different kind of effects. Okay, number 4, let's look at it. Diagram 4 shows the ginger plant. Yeah, state one illness that can be cured by ginger. Okay, relieves inflammation. Ginger can relieve inflammation. Okay, it relieves inflammation. Helps to keep the cardiovascular system healthy. It relieves inflammation, or it helps to keep the cardiovascular system healthy. Name the type of treatment method in question 4A1. Name the type of treatment method in question 4A1. That is traditional method. Traditional medicine. This is a traditional medicine. Name one type of medicine that kills bacteria or prevents the growth of bacteria. Okay, this is already out of the traditional medicine, so we go for antibiotics straight. Yeah. Any medicine that kills the bacteria or prevents the growth of bacteria are antibiotics. Explain why a patient treated by the type of medicine in 2B1 must finish the medicine given by the doctor. So this is a very important question. See, always check the marks awarded for your question. This is 2 marks is awarded for here. Explain why the patient treated by a type of medicine in 2B1 must finish the medicine given by the doctor. The illness. What type of English is that? Never mind. We understand the question. Terangkan mengapa pesakit yang dirawat dengan jenis ubat yang dinyatakan di 4B1 mesti menghabiskan ubat yang diberikan oleh doktor. Antibiotics must be completed to kill all the bacteria if it is not completed. This will allow some bacteria to mutate and develop resistance towards the antibiotic. The mutated bacteria has no effect towards the given antibiotics. So this is why we need to complete the course of antibiotic. Kita harus habiskan sebab antibiotik mesti dihabiskan supaya bakteria semuanya dimusnahkan, dimatikan. Bakteria yang tidak mati akibat kita tidak menghabiskan antibiotik tersebut akan mengalami mutasi, dan bakteria yang mengalami mutasi itu akan membina daya tahanan terhadap antibiotik tersebut, dan bakteria yang mutasi ini akan menjadi lebih kebal terhadap antibiotik dan tidak memberi kesan lagi. So that is the main idea. You need to understand that any antibiotics that was given, you must complete that. Got it? Huh? Next question, that is acupuncture. Raja di atas menunjukkan satu kaedah rawatan yang digunakan untuk merawat penyakit Nyatakan satu ciri kaedah rawatan tersebut. Okay, it does not involve surgery. Okay, does not involve surgery and medicine. It does not involve surgery and medicine. Got it? Okay. Bahagian C pula. Let's look at bahagian C, ya. Okay, so we have completed the objective questions. Okay, we have completed the structure questions. You can see almost the same kind of components are being repeatedly asked. Okay, now let's look into essay question. Okay, so essay question, you got two type of questions. One is experiment based, which is this question here on bahagian C, you can see, yeah. And then on question number 6 pula, it is not experiment based, it is factual based. Faham, yeah? Okay, let's start with question number 5 first, yeah. Kaji penyataan yang berikut. Study the following statement. Ali memotong buah apel untuk disajikan kepada ibunya. Selepas menghidangkan kepada ibunya, Ali mendapati hirisan buah apel tersebut bertukar warna menjadi keperangan. Keesokan harinya, ibu Ali memotong buah apel yang sama dan merencis jus limau pada hirisan buah apel tersebut. Ali mendapati hirisan buah apel tidak bertukar warna menjadi keperangan. Okay, Ali cut an apple to serve to his mother. After serving to his mother, Ali found that the slices of apple had turned brown. The next day, Ali's mother cut the same apple and sprinkled lemon juice on the sliced apple. Ali found that the slices of apple did not turn brown. Suggest one hypothesis to investigate the above statement. Okay, hypothesis is if the apple slices is sprinkled with lemon juice, or I go like this. Solution with antioxidant prevents the oxidation and browning of apple slices. Solution with antioxidants prevents the oxidation and browning of apple slices. Straight away, I give the fact which acts as the hypothesis. Solution with antioxidant prevents the oxidation and browning of apple slices. That is my hypothesis now. 1 mark I scored here. Okay. Next one. Dengan menggunakan hirisan apel, larutan gula, jus limau, larutan natrium bicarbonate, larutan garam dan radas lain, uraikan satu eksperimen menguji hipotesis anda di 4A by using apple slices of apple, sugar solution, lime juice, sodium bicarbonate solution, salt solution, and other apparatus. Describe one experiment to test your hypothesis in 4A. Now, what would be your aim of the experiment? Always start to study or to investigate the effect, the relationship. Okay, to study or to investigate the relationship. Itu memang standard you can start for aim of the experiment. to investigate, I write investigate the relationship, to investigate the relationship between the type of solution, the type of solution, the type of different solution, between the type of different solution and oxidation of apple slices, and oxidation of apple slices. So always remember, aim of the experiment, you got a standard way of writing it. Okey, kamu ada kaedah yang standard, iaitu untuk mengkaji hubungan antara jenis larutan yang berbeza terhadap perubahan warna buah apel ataupun terhadap pengoksidaan buah apel. To investigate the relationship between MV and RV. MV is manipulated variable. What is the manipulated variable over here? Type of different solution is the manipulated variable. What is the responding variable over there? Oxidation of apple slices is what is the responding variable over there. Got it? Huh? Now let's look at the variables. Variables, berapa markah untuk variables? Okay, should be 3 marks for it. Sorry, 2 marks. Okay, depending here they did not show marks here. 9 marks altogether. So they didn't break down for you. Okay, for the aim of the experiment, 1 mark. Aim of the experiment, 1 mark. Procedure, you will have 4 marks. Manipulated variables, you got 2 marks. Let's look at the variables, yeah. So I write down the manipulated variable. Okay, pemboleh ubah dimanipulasi. Pemboleh ubah dimanipulasi. Manipulated variable. Manipulated variable. So jenis larutan, type of solution. And then responding variable. Responding variable. You got color change on the apple slices. And then you got constant variable, something that you did not change. Is the size of the apple slices. Okay, these are the manipulated variable, responding variable, and also the constant variable, which something that we didn't change in that experiment. Next one, list the apparatus and materials. Okay, we are done with this. Next one, list the apparatus and materials. So they gave us 2 things, apparatus and materials. So I will go for my apparatus first. Sorry, over here I will write apparatus. Apparatus. I will have Petri plate. I go for beaker first. Petri plate. Forceps. Okay. Next one, I go for materials. Materials, you write down all the solutions now. What are the solutions that they want you to use earlier? See, sugar solutions, lime juice, even your apple slices are materials. Yeah? Apple slices, sugar solution, lime juice. Then they have salt solution. And then sodium bicarbonate solution. I always write down my apparatus first, and then I will list down my materials. Faham ya? Okay, now next one, they ask us the procedure or the method. So I write here, girls, guys, first point, cut apple slices. With same sizes and soak in beakers containing sugar solution for 15 minutes. Next point, number 2. Using a forceps, after 15 minutes, using a forceps, remove the apple slices and place it on a clean petri dish. On clean petri dish. Okay, another one more. I write down here. After 5 minutes, observe the color change on the apple slices and record them. Record in the, not after 5 minutes, put 15 minutes. After 15 minutes, observe the color changes on the apple slices and record in the table. Okay. Next one, last one, yeah. Step number 4. Repeat step 1. Repeat step 1 till 3 using salt solution, sodium bicarbonate solution, and lime juice. Very simple steps. You are done with the procedure. First step, cut the apple slices with the same size, and soak in beakers containing solution, sugar solution. Soak in beaker containing sugar solution for 15 minutes. After 15 minutes, using a forceps, remove the apple slices and place it on a clean Petri dish. After 15 minutes, observe the color changes on the apple slices and record in the table. Repeat step 1 until 3 using salt solution, sodium bicarbonate solution, and lime juice. Got it? Huh? So for tabulation of data, I create here. So I put my responding variable and manipulated variable. That is the main thing I should have. So over here, I put my manipulated variable, which is type of solution. And then I write here condition of the apple slices. Type of solution, condition of apple slices. So under the type of solution, right, we had begin with sugar solution. And then I have salt solution. And then I have sodium bicarbonate solution. And then I have lime juice. Do not write any reading over here because you did not conduct the experiment. You are just writing down the procedure and preparing the whole thing. So here you should not have any kind of data written there. Okay. So this is how you go about answering. For a 9 marks question, you see the components that you need to develop from the hypothesis, variables, identification of variables. Sorry, my answer is everywhere because I'm trying to manage the space. And then they ask me the list of apparatus and materials. There you go. I write down my apparatus first and then I write my materials. And then they ask me my procedure. Okay, I write down the procedure. I have 4 procedure. Usually procedure, you must have 4 things. How to handle the manipulated variable, how to handle the responding variable, how to handle the constant variable, and the safety measures that you must have in your experiment. And then you have the last one. They ask you to give a tabulation of data. There you go. You must have your MV and your RV listed and make sure it is a clean table. Use a pencil for you to draw the table. Okay, that's all for today's lesson, guys. We have covered discussion on chemical, kimia dalam perubatan dan kesehatan. We are done with this ticket to victory module. Okay, next week we will be looking into another component, another topic. Okay, so revise, recall, recap. I'll be posting this video on in our group, and you can revise back again, and hope that will help during the exam time. Okay, all right, that's all for today's lesson. I'll see you guys next class. Arya.
Yes, sir.
Yes, sir.